tubing you. Can you tell me your name and date of birth? Tell me your name and date of birth. Then I'm going to compare it. Have ID? I will before checking. So, I will verify it with his ID band. I make sure I verify the order, perform hand hygiene. Get my gloves. I'm gonna be talking to my patient, asking them, have you ever had an NG tube before? Do you know what it is? Right, so I know what all I need to explain. It's a tube that's gonna go in through your nose, down your throat, and into your stomach. And then I would also explain to them whatever it is that we're gonna be doing with it, why we're putting it in. Okay, whether it's for them to have nutrition, to be able to eat, whether it's hooking it up to suction to decompress the stomach. I'm gonna explain to them why we're doing what we're doing, okay? Get all my supplies ready. It's weird.
Is it the pump?
I'll go look in a minute. I don't know. Sounds like a hospital, don't it? Okay, so I'm going to put a towel or something over his gown so that it will protect it. I'm gonna raise the head of the bed up, because you want them sitting up when you do this. The bed should already be lowered. Okay, so I'm going to explain what I'm doing. I've got to measure first. The way you measure is you go from the tip of the nose to the ear. And then down to the xiphoid process. Okay, does everybody know what the xiphoid process is? Yes.
It's that.
Yes, the bottom of the sternum, that little pointy thing, the bottom of your sternum, okay? So down to the xiphoid process, okay? And then I'm going to mark my spot with a piece of tape. Okay, that tells me when I get to this spot, I need to stop advancing. Okay, so then I'm going to give my patient instructions. I'm going to let them know what I'm going to do. Okay, so when we start, I'm going to tilt your head back until the tube gets to the back of your throat. Then I'm going to assist you and instruct you to lean your head forward and take sips of water. Okay, so I'll have him, and then I have this here just in case he gags and throws up. All right, so I would have them hold the water. Going to get me a few pieces of tape ready to go so that I'm not scrambling for it when I get to my spot. I do 1.5 so that they're thinner. You'll see why here in just a second. I do one that's a couple of inches and I split it, but not all the way. Split it about halfway, 3/4, somewhere around there. Or it looks like little pant legs. Okay, now we're ready to begin. So he's gonna start by having his head tilted back, okay? I would also inspect the nares. I would ask them if they have a preference. Have them occlude one side, breathe, occlude the other side, breathe. You wanna make sure that if he's stuffy, you don't put it on the clear side and then he can't breathe out of the other nostril.
Makes sense.
Okay. All right. So we picked a nostril. You would also lubricate the end of it, okay, so that it will pass a little easier. Okay, and start advancing it down. And then when it gets to the back of their throat, okay, lean forward. Drink, drink, drink. Now these mannequins, your tube will not advance all the way where it needs to be. It just won't. On a real person, it will. In fact, these mannequins, they don't hardly advance at all. Some of our older ones, they advance a little bit more. So the whole time you're having them drink, 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 because that helps aid it down into the stomach, okay? Once you've gotten to your taped part, which we're gonna pretend like we're at our taped part, but it's not it. Well, now it's starting to kind of advance. If you meet resistance, you can twist. Same on a real person, okay? Kind of just twist it lightly and have them drink. Okay, that's as far as it's gonna advance on him. So I'd hold my spot, take a piece of tape, and just, it's not gonna be pretty right now because I wanna verify my placement before I tape it up to where it's gonna stay. I just want it to hold it in place so it's not gonna move while I check my placement, okay? So what are the ways that we can check placement? Check the pH. So if we were gonna check the pH, I would have my test strips right here on the table. I would attach my large syringe to the large hole, and I'm going to withdraw till I get gastric contents. I'm gonna remove it, and then I would put it on my test strip, wait for it to change the color it's supposed to change. I know I'm in my right spot, right? Okay, how else can you check placement at the bedside? With the stethoscope in air, okay? So I'm going to put about 30 mLs of air in my syringe. I'm going to attach my syringe. Put my stethoscope on, and you're gonna listen about an inch below, right below the xiphoid process, okay? Take your syringe and fast in like that, and you should hear a whooshing sound. So what's the last way that you can test placement if you can't verify it in those two ways? X-ray. Which one is the absolute most reliable?
X-ray.
X-ray. Okay, so now I'm in the right placement. This is typically safety pinned to their gown, okay, so that it doesn't pull. It's got plenty of slack. Now I'm going to tape it up on their face, okay? So I take my little pants leg, and I'm going to put the part that's not torn across the bridge of the nose like this. Then I'm going to take my pants legs on either side, and I'm wrapping it around like that. I take one of my other pieces of tape, go across the bridge of the nose just to make sure that that is secure. Okay, and then you can leave it like this. You can tape it to the side of the cheek. Make sure that the tape isn't anywhere in their vision field, because that is very bothersome. Like you can imagine on you that would be irritating. Okay, so want to make sure that you keep it neat and tidy. All right, so that it doesn't get in their way. And then you've got all this slack. Okay, so you don't have to worry about them pulling anything. Good? Okay, removing my gloves, perform hand hygiene again. Yes, ma'am.
So do we have to take the side so that where the air naturally goes to
Yeah.
stay up?
Yes, it needs to be up above the level of the stomach.
So can we put a little tape?
You can. Okay, so it's up above the level of the stomach. The sum. Okay, if you have it below the level of the stomach, you're gonna have leaking. Okay, so it needs to be above. Now to take it out, basically the same way you put it in, you're just pulling it out, okay? So you would do hand hygiene, you would tell them what you're doing again. You're gonna remove all of your tape. Okay, you put gloves on again. You're gonna explain to them what you're doing. Let them know it's kind of uncomfortable, but it's fast. If they need to cough, that's okay. The coughing kind of helps push it up anyway, okay? So, all right, take your deep breath. Okay, here we go. And they're gonna probably cough as you start pulling it out, because it kind of stimulates that cough reflex. So then you hold the end of it